Welcome to the session of online class, and today's topic discussion will be regarding aesthetics. Okay, it sounds little different when you speak about aesthetics to a undergraduate students. Okay, and eventually all individuals will dream for a good aesthetic sense, and dentists primarily are concerned with the beauty of your face, which in turn depends upon the structures that is associated in the face. Okay, your maxilla or mandible, that is the bony structures, and the tooth part, your dentition. And then how your tooth is really placed, and eventually when an individual smiles, it should be pleasing. Most of you will dream for a pleasable smile. If suppose an individual is having an unpleasing smile, the more commonly seen in the growing individual. Okay, the growing individual in the pediatric patients, the pediatric ward or pediatric OPD, when you come across a child with an unpleasing smile, as a clinician, you should be in a position to rule out where the problem is. And there comes the significance of this topic about aesthetics. Aesthetics is a prime concern nowadays. Previously, females used to think about pleasing smile or aesthetic sense. Now things have changed. All individuals, depending on the socio-economical status, rich or poor, white or black, everybody wants a pleasing smile. Everybody wants to be aesthetically healthy. And the treatment part that should bother about the clinician is how this aesthetic can be achieved. And before achieving a pleasing smile, you should know to diagnose where the real problem is. Okay. Smile forms the major chunk of your aesthetics of your face. So the 5 elements of a youthful smile. The 5 elements is youthful smile is, see, for suppose if you smile, eventually the upper tooth, the dominance of the central incisors is more seen, which proper brightness, and a good smile will be the convex smile line. The smile line, okay, will be a convex smile line is the good smile. There should be adequate fullness, and the criteria for designing a smile design is it can be evaluated by doing a composite mock-up. Mock-up is you take the negative replica of your tooth structure, the patient. Okay, you do it in the lab. You do a composite mock-ups or wax mock-ups, or with the help of the computer imaging, you can vary the length of the tooth. The crown part of your tooth can be elongated or it can be reduced to get a pleasing smile. As I said earlier, a good smile is smile line will have a convex smile line is a pleasing smile. Now, how do you diagnose the patients having a improper smile. See for suppose, when you see an individual with incompetent lips, unable to close his mouth properly, or he is forcibly closing it, that is called as, either it can be incompetent or it can be forcibly competent, or it can be loss of mouth closure. Your tooth position will be in such a position that your anteriors, the upper anteriors and the posterior, or the anterior maxilla will be more forwardly placed, so the patient will have difficulty in adequate smile. So eventually he can't smile. So clinically, there are various conditions wherein you have a problem that is concerned with the upper jaw, your maxilla. It can be more forwardly placed. It can be a prognathic maxilla, or it can be a retrognathic maxilla. If the maxilla is not to its fullest shape, that means it is not grown fully, then it is set back. It is positioned posteriorly. That is called as retrognathic maxilla. If it is forwardly placed, it is called as prognathic maxilla. If it is placed backwards, or if it is placed posteriorly, then eventually it is called as retrognathic maxilla. So before going into this smile design, you should bother about the profile of the patient. Profile is nothing but a 3-point parameter. Okay, the profile of the patient asks the patient to look in the sideways. Okay, it is a 3-point parameter. As patients look through sideways the patient. Okay, the profile can be either it can be convex profile, or it can be a straight profile, or it can be a concave profile. So the facial structure or facial form will differ according to the clinical condition that is prevailing. As I told you earlier, the maxilla is placed forwardly placed. Then patient will have more convex profile. If suppose the maxilla is backwardly placed, if it is underground or it is retrognathic, whatever it is, then eventually patient will end up with a concave smile. One is the convex, the other one is the concave smile. If it is ideally related, if your maxilla and mandible is ideally positioned, then patient will have a straight profile. This is how you're supposed to evaluate the profile of the patient. If with a concave profile or a more convex profile, there won't be any aesthetic value for the patient. Then you should guide the patient to a proper consultant and explain to him the treatment modalities that is available nowadays. And the general practitioner, one thing is you should diagnose the condition properly, guide the patient to a proper consultant. And the third part is explain to him the treatment modalities that is readily available now. These 3 things should be very important for all the undergraduate students. Now, everything starts with the history. When you make a diagnosis, first is your preliminary analysis. Starts with your patient history, then is your clinical examination, then is the diagnostic records, what is available. When you speak about the diagnostic records, one thing that strikes your mind is you take a elaborate patient history. You do a thorough clinical examination. The next one is your diagnostic records. Most commonly, readily you can use your cell phones. You can make a photograph. You can ask the patient to smile, or make the patient to see the sideways, look, click a shot, look for the profile of the patient. In the photographs can be a vital tool in your diagnostic making. You want to make a proper diagnosis. One is you make a clear case history. Second is your clinical examination. The third is your records, diagnostic records. Most commonly, you can use your simplest thing is you can take a photo. Okay. Now, when you take the photo, you can clearly assess the profile of the patient, how his facial form is, which part of the face, the maxilla or mandible is problematic. Clinically, you can see. Now, comes the next one is your technical thing. These things are preliminary analysis. What you do is, next is your total smile analysis. That the most common is your visual analysis. Then the space analysis. Then the profile analysis. Then the help of the computer. You do a computer analysis. Okay. Basic things you concentrate more. Make a clear patient history. And don't miss out anything when you clinically examine the patient. Then, with the help of your cell phone, you can take a photograph. Now, the upper lip line, the length of the maxillary incisors, then the vertical position of the gingival margins. See, when you see the photo over here, okay, as I told you earlier, the ideal smile line is your convex smile. Okay, that means he's having a pleasing aesthetic. Then the next thing you should strike your mind is your length of your maxillary incisors. How the maxillary incisors is present. Okay, suppose any abnormal tooth shape or tooth form, as discussed earlier, if it is forwardly placed, or if it is protruded, or if it is proclaimed, or tooth is having any spacing in between the teeth, these things should be taken care of. Then the third thing, when you should look into what is the soft tissue, that is the gingiva, your gums. Simple term is gums. Looking for the position of your vertical position of your gingival margin. Okay. The other clinical interesting thing is when you closely watch all patients. Okay. For some patient, the gums will be visible. Okay. To a certain extent, your gums can be visible when you're smiling. And if it is visible too much, that is called as gummy smile. Most commonly associated with the long face syndrome. See, for suppose today, when you see a patient with gums visible, then it should strike your mind that there is a real problem with the smile. So that can be corrected. Now, all other things, when you speak about these aesthetics, why you should really bother about these things? It will have a psychosocial impact. The patient, the general well-being of the patient will be affected if these things are not being taken care properly. Okay. Basically, you should look for the smile line. Look for the tooth position. Then you see for any appearance of the gums when the patient is smiling. Look for any gummy smile. I suppose abnormal tooth position is there. Then it should strike your mind. Patient needs the treatment, proper treatment. Okay. Then The next is your aesthetic analysis. One is the facial analysis. Next one, dentofacial aesthetics. Third is the phonetics. Fourth is the gingival aesthetics. Now, how do you analyze the face? Now, in this diagram, as I told you earlier, face is divided into three parts. Upper third, middle third, the lower third. The upper third is from the frontal lobe of your skull. The middle one is your maxilla and the adjoining structures. Lower third is the mandible. When you see all these things, you should see for all these things. And hairline, tip of your chin, and the lateral view. The profile, as I discussed earlier, profile is a 3-point parameter. It can be convex, it can be concave, it can be straight. Then the shape of the lips. It can be thin, medium, thick. See, when you see all these things, one is the protrusion and intrusion to be analyzed. These are clinical signs. Then comes to evaluate the amount of visibility of your anteriors. Okay. The patient asks the patient to pronounce some words. This is called as a phonetic references. Ask the patient to pronounce something. Suppose the abnormal portion is there in the central incisors. Then eventually, patient can't pronounce F and B if there is a lingual tilt in the central incisors. And S sound for vertical dimension of speech. Now, the other thing is, as I told you earlier, you come across patient with an unpleasing smile. Okay, you're able to diagnose it. Then another thing is, you should guide the patient properly and you explain to them what is available treatment modalities. Okay, can be corrected through simple metallic ceramic films restorations, or can be replaced with the ceramic restoration. Or simple thing is can be restored with a composite, or it can be changed bleaching to get a proper hue and chrome. Okay, can you see in this picture? You can see a fractured tooth, anterior tooth. That is your lateral incisor. Okay, and it is very readily treated. Okay, we're doing a simple filling that is called as direct composite resin bonding. The advantage is you get an immediate result. That is the patient satisfaction is achieved in 1 or 2 visits. It is more of a conservative mode of treatment and relatively low cost. And the disadvantage is the strength, the bond strength will be little less. So if he tends to bite anything hard, then chances there for repeated chipping. Then comes the replacement of the tooth with either metal ceramic or a total ceramic. These things, ceramic rounds, since it is in the anterior part of your mouth, more readily visible, then the tooth replacement is a big issue. It should be restored properly. The frequent mistake what all clinicians do is end up with a deficient crowns. The incisional plane will be too straight, it will be canted, it will be too narrow, and obviously the incisional profile will be over contoured. See, this is the frequent mistakes that is seen with the improper crown, deficient crown. Okay, your incisional plane will be too straight, your incisional length will be too narrow, and your profile will be. The next type of replacement is with your porcelain laminate veneers. And you see the picture, you can more readily appreciate how your abnormal shape of your lateral incisors is changed to a adequate crown through a porcelain laminate, and the patient with any stains in the tooth. So with any stain or discolored tooth, stained tooth, eventually patient can't have a ideal smile. So that can be treated. This is the porcelain laminate. These are the mode of replacement concerned with teeth. And I'll brush through the points, okay, important aspects that you should not miss when you examine a patient is: one is your profile, the next is the airline, then do a proper facial aesthetics. Now, you should not miss to see the upper lip line, the length of the maxillary central incisors. And before concluding this session about the aesthetics, they want to make a note that a proper patient history, a good clinical examination with the help of a diagnostic record, we can arrive at a proper diagnosis. And with this, I conclude the